Hi everyone, I'm Andy Yu here.
Hi, I'm Elijah.
Okay, we are from the Wealth Hero.
Yep, and today we're going to talk about what kind of insurance is available for the coronavirus.
Okay, so before we go on to the main topic, I just want to remind everyone to remember to subscribe to our video because we're going to publish our video almost every week. So for more great contents, please remember to subscribe to this video.
And ring the notification bell so you get notified of new episodes.
Okay, so Elijah,
Yes.
what are the insurance that's
Available for the coronavirus.
Coronavirus. That's
Okay,
the hot topic.
so yeah, it's a very hot topic now, the coronavirus. It's been raging for a few months, and of course, I have also been getting questions like what kind of insurance is available for the coronavirus. Now, I will say there is no specific insurance available for the coronavirus just yet. Okay, but for example, if you get hospitalized, the government has already said they will cover you for your hospitalization bills. So this brings us to the first thing is you got to have a good medical plan. Because it is not necessarily the coronavirus that may get you, but at any point in time you should have a good hospitalization plan so that if you're warded, then you will be, you can be certain that your majority of your hospital costs are covered. Yeah.
Okay,
so that's the first thing.
Okay, so what if like for people who are, let's say, working in Singapore, they are not Singaporean?
Right, so most of the time if you are working, I would say your company will cover you, but you also need to be aware of the limitations of the company's coverage. I have a client actually who just took up a hospitalization plan with me 2 weeks ago. Now that's because although she was working in Singapore, she actually has hospitalization coverage of only 10,000 a year. So yes, she is covered if she goes to hospital for any reason, but 10,000 a year just wasn't really cut it. We know that some hospitalizations can be very costly, and as a data point, okay, I have a mom. She's my client, and her son was just born about June last year. Now the son was actually awarded in February for some breathing issues at a government hospital. So I think the duration was about 4 days. You want to guess the bill?
Oh.
Government hospital.
Government hospital.
Yes, I got the receipt for the bill. It was settled, but you want to guess the bill?
$3,000. 7,000.
Yeah.
Okay.
So the hospitalization plan paid about 3,000 plus. The rider, which is another important component, paid another 3,000 plus. So mom was out of pocket by only about 300, and the best part was mom could use the MediSave to pay for that, so she didn't actually have to pay cash. So yeah, so you can see that regardless of the situation, it's very important to have a good hospitalization plan. Yes.
Okay, so what if the person like you want to look at the hospitalization plan? So usually what are the things they want to compare?
Yeah, so most of the time you want to look at things like your level of coverage. This would mean, are you going to be eligible for a government plan or a private plan? These are the two major type of plans available in terms of coverage level. You also want to ensure that you have a decent pre and post kind of follow-up, because after you get discharged, it's usually not the end of your treatment. You probably have to go back. So when you go back, you incur all those outpatient costs relating to your admission. So where will you claim that from? So something that I would like to point out, MediShield Life, which is what all Singaporeans and PRs have, you do not have pre and post hospitalization coverage. So only a Shield plan can give you this additional pre and post hospitalization coverage. I have a client last year who was admitted in January, and she was admitted for a quick op to remove a kind of abscess. And her follow-ups kept coming in over the months, and I think I must have claimed more than $1,000 for her. And actually her admission was a simple one. The actual hospital stay was less than 1,000, but her follow-ups were more than $1,000. So you can see how important it is.
So all the follow-ups is actually also
claimable. Yes,
okay.
she just went to see them, paid first, and then submitted the claims to me on every 2 months or so I could help her to process. So that's one very important thing, hospitalization coverage. Another one will be actually critical illness coverage. Now, while the coronavirus is not a critical illness, but let's say in the event it leads to complications and you develop, say, a critical illness, we know that MOH has stated that there are some people actually in a critical condition now in the ICU.
Yes.
Okay, so if let's say the coronavirus led you to, being in a critical condition, say as a coma. Okay, a coma is actually under the list of 37 standard critical illness. If you fulfill the full definition of the coma under that, actually a critical illness coverage would have no reason not to pay out. You probably get the payout. So of course, it's not just about the coronavirus. A lot of things can happen. So say if you have cancer. Okay, actually this is a very sad story. Last Friday, someone I know for a long time but I haven't kept in touch, he passed away from brain cancer, and he was only 33. Yeah, actually I actually didn't know he had cancer, but because I lost touch with him. But yeah, apparently his cancer was came back, and then he didn't make it. He would have actually been unable to work for quite a while, I believe, and so a critical illness coverage would actually pay him a lump sum of money to ensure that he still has money to for his day-to-day expenses. Now, that is very different from hospitalization, because hospitalization is covering your bills, but critical illness gives you a sum of money to cover non-hospital bills, things like you still need to eat, right? You still need to pay your utilities, all that, while you are at home recuperating. So they are actually very different classes of insurance. A lot of people ask me, what's the difference? And that's your difference. That's the key difference.
I believe the cost is also one of the things that people actually look at. Right?
Yes, so of course you want cost-effective coverage, and naturally you actually want to be able to compare. So for those who don't know, actually we are brokers. So we can actually help you to compare across the different insurers, so you can see which is the more cost-effective coverage for you.
I see.
So these two will be very, very important. And although no one has died in Singapore yet for the coronavirus, there is one more thing you need to consider. If you have dependents, you need death coverage. So for example, touch wood, of course, if someone has coronavirus, gets admitted and then passes on, what happens to the family? Would there be money needed to at least provide for the family, especially if it was sole breadwinner? Yeah, that's the most common thing. Even if it's not a sole breadwinner, you actually leave your other spouse in a very tight situation. So no matter what, you have liabilities, you definitely need death coverage to cover your liabilities. Yeah. So in summary, you got three types of insurance. First one definitely is your hospital plan. Okay. Second one is your critical illness, and these two are very, very important. And the third one is if you have liabilities, you want death coverage.
Okay.
Yeah.
I see. Yeah. So right now, I think because of all these, a lot of people, because of all this coronavirus, a lot of people are actually coming to us.
Yeah. Actually, I've been very busy over the past 2 weeks.
Yes. So
it's been crazy.
Yeah. So please remember, if you need any help, please feel free to comment in the comment box below. If you need to meet us, please just email us or WhatsApp us.
Yeah,
and book your appointment earlier. Okay.
I'm actually booked all the way to end of March.
Yeah. So basically, we have a lot of appointments ongoing. We're trying to help everyone answer their questions. But if you got any questions, please feel free to comment in the comment box below, and we try to answer most of your questions. So thank you for watching this. We'll see you in the next video.